Libby Roy, an internal medicine physician. And Dr. Roy, BuzzFeed has already reported that more than 11,000 people have already been arrested at these protests. And there's a concern that people who were put into then overcrowded detention facilities and police stations might be at risk of COVID. And then on top of that, we've had tear gas that's been used on protesters, whereas they're breathing that in and then coughing that out. The New York Times says that along with the immediate pain that can cause watering eyes and burning throats, tear gas may cause damage to people's lungs and make them more susceptible to getting a respiratory illness. According to studies on the risk of exposure, the gas can also incite coughing, which can further spread the virus from an infected person. Do you expect 2 weeks from now we're going to be talking about a new set of outbreaks from these protests, coming from these protests and their arrests?
Good evening, Joy. It's good to see you after so many days. The concern amongst many of us in the medical and public health communities is that there will likely be an increase, if not a surge, in cases in hospitals all over the country that have faced these protests. And yeah, the tear gas, in addition to just severe mucosal irritation, eyes, throats, there's a study actually done by the U.S. Army in 2012 that showed that days after exposure to tear gas, people were at increased risk for developing an infection. But I also just want to say that, there's nothing like a pandemic to expose the existing cracks in the U.S. healthcare system. I said that before for coronavirus, but it applies right now regarding decades, if not centuries, of racial inequities. And we're seeing that now. And I just want to be very clear as a physician that racism is a public health issue, if not a crisis. And I want to make sure that the families of Mr. George Floyd and Breonna Taylor and multiple other people whose deaths were not captured on camera, that I can convey my sincere condolences, and we all need to act, including the medical community, to make sure that we correct these wrongs.
Yeah, it is ironic that the killing of these black people who had done nothing, that their murders are now prompting, in places where there already were spikes of COVID-19 that were disproportionately affecting black and brown people, that then there's another risk to them. That is the sort of tragic, sort of horrible irony of all this. Even before that, you had, on top of that, you also just had Memorial Day weekend, where before this all happened, you also had people coming back out. There are states that are reopening. Have we kind of reached a perfect storm for COVID-19 to make the summer even more hellish?
That's a great question, Joy. Earlier, I heard Professor Eddie Glaude, who's been a frequent guest on MSNBC, talk about how he's from the Gulf Coast and hurricanes, and I can relate to that. I did my medical training in New Orleans, and he talked about the fact that right now we're in the eye of the storm. All of these different issues, these different scenarios are coming together. And, look, I kind of have mixed feelings here, because a part of me is actually really inspired by seeing these protests, and especially seeing all these young people protesting. But on the other hand, as a public health advocate and doctor, I'm really concerned, because right now we have not contained this virus. It is out there, and the concern that I specifically have is that it's the young people who may actually carry the virus. They won't